Let's talk about how computable biomedical knowledge, or CBK, can transform health. Experts from the informatics, library, clinical, and health system communities are actively thinking about the dynamic ways that computable biomedical knowledge will positively impact health and health care. We connected with some of these experts to hear their perspectives on computable biomedical knowledge.
Computable biomedical knowledge is going to prevent health systems from reinventing the wheel at every single turn. It often takes decades for evidence to be translated into the hands of clinicians, and if we can accelerate that process, we're really going to have a positive impact on patient care and cost effectiveness.
So as a physician, some of the most exciting potential impacts of computable biomedical knowledge on health and healthcare are when it can help us individualize care, when it can help us personalize treatment choices. And it can do that by encapsulating knowledge in the form of predictive algorithms that can be very powerful and let us understand how to individualize treatment choices based on an individual person's risk factors. What are their chances of developing lung cancer, for instance? And that really can drive the benefit of different treatment choices.
Computable biomedical knowledge, from the perspective of the health sciences librarian, is an information asset that must retain all of those things that we care about and that are important for it to have its full impact in health care. And that includes its discoverability, its accessibility, preservation, replicability, and our ability to recognize in it that the information is equitable and derived from data that was equitably created and managed and maintained.
Computable biomedical knowledge will improve the consistency of care delivery. Human beings, even the best and brightest, cannot achieve consistency in complex, information-overloaded environments. And all of us tend to believe that our best performance is our average performance, when in fact it never is. Consistent inputs leading to consistent and measurable outcomes is much more within reach with widespread adoption of computable biomedical knowledge.
Our experts are also thinking about the relationship between computable biomedical knowledge and the concept of a learning health system.
Computable biomedical knowledge is a continuous quality innovation that has enormous potential for ensuring that knowledge information assets are effectively integrated into systems such as learning health systems, and with the potential for improving and enhancing quality patient care and as well the experience of the caregiver.
We have been doing patient-specific clinical decision support for more than 40 years and have not created a learning healthcare system. For that, I believe computable biomedical knowledge needs to be combined with closed-loop decision support, where the same infrastructure that recognizes that computable biomedical knowledge is available and then delivers that knowledge when and where needed goes on to do systematic downstream monitoring of processes and outcomes to correlate with the inputs provided. This creates a learning healthcare system that has the very attractive property that it learns and gets better whether or not the practitioners accept the advice provided.
Another exciting thing to think about with computable biomedical knowledge and thinking about it as a prediction tool is we're reaching a critical point in our health systems where we have more and more data, longitudinal data, and we have this big data software and increasing informatics infrastructure that's allowing us to be able to create our own risk tools. We don't have to do prediction tools from outside. We can create them within our own health systems and predict better for our own patients and continuously improve the individualized, personalized treatment choices based on prediction tools derived from our own health systems.
So computable biomedical knowledge will help clinicians translate evidence on paper into clinical settings quickly so that we can find out what works and what doesn't on actual patients and fine-tune our approach. Over the past decades, the world of informatics have given us a lot of tools in clinical decision support and analytics. I think computable biomedical knowledge is going to help bridge the gap between theory and practice.
It's clear that computable biomedical knowledge holds great promise for improving health and translating knowledge into practice. At the same time, it's equally clear that there is exciting and important work to be done in order to realize that promise. Let's work together to explore ways to transform human health with computable biomedical knowledge.